I'm a pediatric gastroenterologist. I work at Mass General Hospital for Children and the Ladders program, which is the Learning and Developmental Disorders Clinic at Mass General for kids with autism and other developmental disabilities. I think I may be one of the very few pediatric gastroenterologists involved in a developmental clinic. We have a large number of kids who we see who come through the general autism clinic. There is data that suggests about 70% of kids with autism have gastrointestinal issues, a very large number of kids. But gastrointestinal problems are fairly common in pediatrics, so we don't know for sure how often these problems are an issue more in autism versus the general pediatric population. We're still trying to learn that information. That said, we know certain things. We know, for instance, that the prevalence of food allergy is about 5 to 8% in the general pediatric population. There are studies now that have shown that in autism, food allergy alone is as common as 36% from one study, Dr. Lucarelli in 1995, and as high as 50% in a study that was published a couple years ago by Dr. Horvath. So it's extremely common to see issues of food sensitivity and food allergy in kids on the spectrum, and we know that based on several people's work. Other conditions are probably harder to sort out, whether they're more common in the general population or the autistic population. Kids, for instance, with acid reflux or constipation or colitis, it may be much more difficult for us to see whether those kinds of problems are more common in kids with autism. But what I do know, at least what I believe, is that these problems are very poorly recognized in kids with autism. So the problems that are fairly easy for a 6-year-old to talk about, pain having a bowel movement, really difficulty going, screaming, crying when they go, might exhibit itself differently in a child with autism. That might be a child who has tantrums or seems to be very upset 2 and 3 hours before they have a bowel movement because they're having distress and they need to go. They simply are not able to vocalize what's going on. How does a child with autism say, I have heartburn? How does a child with autism say, I've got abdominal pain? Well, they may say that by pushing on their belly and seeking belly pressure or having their belly rubbed. That may be the only way they say it. They may say it by being aggressive because they can't ask the question, can you give me help? They may say it by self-injury. They may say it in all sorts of ways, sleep disturbance. And so it's a different world in kids with autism to do medical investigations because those symptoms are just not as clear, they're not as easy to sort out, and we have to listen better, and we have to think about the connections better. We see a very large number of kids who we think have food tolerance issues for sure. As I said, food allergy is a very common problem, and a large number of kids that we see, we are going through dietary interventions to figure out whether a restriction of certain foods or whether reactions to certain foods are part of the problem that accounts for behaviors. Oh, I think it's a very good place to start, and I think that it's one of the core kinds of information that you can test for fairly easily. You have to understand that there's limitations to the tests, and so a blood test or a skin test that looks for food allergy might be helpful, but it doesn't completely exclude the possibility that children have a problem with a given food. Withdrawal and re-challenge is one of the best ways that you can ask the question, is my child better with or without this food? And so there are an awful lot of kids that going through basic laboratory testing, look at immune testing, look at allergy type testing, is a very reasonable first step to do to try to figure out if you can get guidance from those tests to make it an intervention for kids. As a core set of testing, we typically will do, I think, basic screening that's often not done unless kids have other reasons to have it done. We do a blood count to look for signs of anemia or to look for signs that the white blood cell count is suppressed because of an immune problem. We do a test called the sedimentation rate, which is a simple blood test that looks for inflammatory change. We do a test for celiac sprue always on every single child that we see, which is a way to look for gluten food sensitivity, wheat, rye, barley. Those foods may be a trigger, and in any kid who's got gastrointestinal symptoms at this point, that should be part of the core investigation. That test is only valid if you do it at the time that kids are on gluten-containing foods, however. So if kids are already on a diet, that test may not help you to exclude that problem. We do core immune tests. We do an immunoglobulin panel where we look at the IgA level, the IgG level, the IgE level, which are the immune proteins that your body makes in response to infection or other issues. And that's a pretty good core pass looking at blood testing. We do RAST testing to look for food allergy issues, but again, understand that they're relatively limited in what value they have. If they raise a flag that there could be a food that's a problem, I think they're helpful in that way. We will often, depending upon what the symptoms are with regard to stools, also do stool testing. And we always look for blood in the stool. We would also look for white blood cells in the stool. We would do parasite testing, bacteriology testing, looking for infectious issues that are going on. We look for malabsorption issues. So we do stool testing, a stool elastase, which is a screening test to look for pancreas insufficiency. We do stool for fat still, which is a gross screen, but it is a screen to look for evidence of malabsorption. And if any of those tests are abnormal, it gives you some guidance about whether you should go on and do some other investigations on those kids. Pure IgA deficiency happens in 1 in 500 kids, so it's pretty common. Relative IgA deficiency, where the level is low, is probably more common than that, and that those levels are low and maybe not so helpful, but will gradually rise into the normal range as kids get older. And it's not that uncommon for kids who've got chronic diarrhea issues or food allergy issues or frequent ear infections to be IgA deficient as young kids, and as their immunity improves, those problems seem to fall away. So we know that that's an important factor in the wellness of kids. If those levels are low, it's relevant. I think that kids with autism have a right to have any medical condition that kids with autism that don't have autism have, and that may sound simple, but it's not so simple. I think that it's very hard to identify acid reflux issues or colitis issues, much less function problems like irritable bowel syndrome in kids who can't give you a very good history to account for what's going on for them. The most severe findings that we've found are kids who have very severe erosive esophagitis from acid reflux, and they haven't been able to make it clear to their caregivers that that's what's going on. Those kids are miserable, their sleep is impaired, they feel terrible. Some of those kids have a terrible time learning in their educational program. They're miserable all day because they've got acid reflux. They have aggressions, they've got self-injurious behaviors, and when you treat those issues, they feel better. Does it fix their autism to treat those issues? I'm not so convinced, but I am convinced that if you have rip-roaring esophagitis and terrible heartburn 20 hours of your day, you are not going to learn, you are not going to progress in your educational program, and no matter what you do, you're going to look worse. And so at a minimum, working on the biological factors, working on esophagitis, working on migraines, working on chronic infectious processes that we're not doing a very good job managing is so crucial to getting that kid bolstered up so he can go into his classroom and have better success with whatever educational program we're offering to him. I think one thing that's important is actually something that was your own experience, which is because you go to a doctor, and this is no rap on your pediatrician, doesn't mean that your pediatrician is an expert in autism. It doesn't mean your pediatrician is or should be an expert in the medical management of these issues. We're learning what the medical management of these kids is right now. So we haven't done a good enough job getting the word out, if you will, to traditional pediatricians and other caregivers what's going on with this core subgroup of kids. But what it means is that the parent really has to take a a real strong role in the medical management of their children. They need to say, I've recognized these problems in my kid, and I'm going to pursue them. I'm going to make sure that you attend to them. I have a suggestion about that, and that is that if you go and see your pediatrician and you don't have much responsiveness, in part it may be your fault, because you walk in and you say, hey, I've got an autistic kid and I want you to check his ears and I want you to check his diarrhea and I want you to check his XYZ, and there's just too much on the docket for that pediatrician to handle in the 10 minutes that he's allotted to your care. You should go to any pediatrician or provider in a very focused state. If you want to focus on why my kid has chronic belly pain, focus on that pain. Make it the purpose of the visit, and let that pediatrician spend that designated time helping you work on that particular problem. Don't go in with a broad agenda. If you can't get satisfied with the care that you're getting for particular issues, you need to really seek people who do this a lot. Unfortunately, there aren't enough, I think, of those providers yet, but they're becoming more and more, and there are many centers now that are working on developing a multidisciplinary approach to autism, where there is a GI doc who is enlightened, that there is a neurologist who's enlightened, that there are other providers who are willing to pursue the medical workup of these kids to make sure that they're healthy and to make sure that they're setting the table for their success. And those people you may need to seek. They're not everywhere. They're at special places. And maybe they'll be at a clinic near you soon.